Understanding the draft procedures is essential for advanced management of chronic frontal sinusitis and complex sinus cases. These procedures range from minimally invasive approaches to extensive surgeries, each progressively increasing access to the frontal sinus. Let's break down each type. Draf I is the least invasive and is often the starting point in managing frontal sinus disease. This procedure involves a complete ethmoidectomy in the region of the frontal recess. Essentially, it clears out the ethmoid cells around the frontal recess area, opening up the pathway to the frontal sinus. Indications for Draf I include less severe, localized disease or cases where initial drainage is sufficient. It's less risky but may not provide adequate drainage if disease extends further into the sinus. The Draf IIa procedure goes a bit further than Draf I. Here, we remove the floor of the frontal sinus between the lamina papyracea and the middle turbinate. This approach offers more direct access to the frontal sinus compared to Draf I, which makes it suitable for cases with moderate frontal sinus disease or when Draf I hasn't provided enough relief. The Draf IIa is a valuable technique because it minimizes tissue removal while offering increased drainage potential. However, it's still relatively conservative compared to later stages. In Draf IIb, we expand the access further by removing the frontal sinus floor between the lamina papyracea and the nasal septum. This gives us more medial and lateral access to the sinus. The IIb approach is often indicated for more extensive frontal sinus disease or recurrent infections that haven't responded to previous surgeries. It's a reliable option for enhanced drainage while keeping the procedure minimally invasive. Surgeons often use Draf IIb when they want to avoid more aggressive interventions while still achieving good drainage, especially in patients with a history of chronic sinus issues. Draf III, also known as the modified Lothar procedure, is the most extensive approach. Here, we remove the entire frontal sinus floor from orbit to orbit, including parts of the nasal septum, nasofrontal beak, and frontal intersinus septum. This approach essentially creates a single, large drainage pathway across both sides of the frontal sinus. It's typically reserved for the most severe cases, like refractory chronic sinusitis or patients with polyps that obstruct drainage despite previous surgeries. Draf III is effective but highly invasive, carrying higher risk for complications. It's a commitment to long-term drainage that can help prevent further interventions. Each draft procedure incrementally increases access and drainage capacity in the frontal sinus. The choice between them depends on the extent of disease, patient history, and prior treatment response. For instance, a Draf I may be effective for localized disease, while Draf III is a last resort procedure for those who need maximal drainage due to severe or refractory conditions. Understanding these nuances helps surgeons choose the most appropriate level of intervention, balancing efficacy with patient safety.